balance right. And you only do that by working together. And so that's what we're doing.
That's a little audio from Kylie Stanton's report on the doctor shortage as we dive back into the BC healthcare capacity crisis. You heard Health Minister Adrian Dix there trying to find ways to work together with physicians to curb what is a severe systemic issue. I mean, we're going to open up the phones in the next segment about, are you struggling to find a GP? Do you have a doctor? If you do have a doctor, how difficult is it to get an appointment with your doctor? I mean, the stories are just ever growing and stressful, particularly in this time where health issues, not just in a global pandemic, but also those things that weren't addressed over the course of the last 2+ years. I want to connect now with BC family doctor, BC family doctor Jennifer Lush is on the line with us. Thank you so much for being with us, doctor.
Thank you. I really appreciate the time to be here.
Let's talk through what your day-to-day is like and what the struggle is for physicians. We hear, as I was saying in the setup there, how people struggle to find a physician. When they do, it's often difficult to get in to see one because the doctor shortage is very real and a big piece of the healthcare capacity crisis right now. What is needed and what are you seeing?
Thank you. Yes, well, certainly the system that we are currently trying to function under is a very overburdened and broken system. And family doctors are trained to provide excellent longitudinal cradle-to-grave exceptional care, but that's getting harder and harder to do in a system with, longer wait times and more difficulty accessing services for our patients. More complex patients requiring and deserving more time to be spent with them, but at the same time, family doctors not being compensated for providing patients with that extra time, which then meets the challenges of running a business in, an environment of rising costs, more and more difficult to navigate. So all of the above really contribute to the increasing burnout that we're hearing about and the, steadily increasing number of doctors that say we just cannot continue to sustain and support the infrastructure of the healthcare system as we've been doing for all these years.
I loved a quote that I read from you in the Agassiz Harrison Observer. That's where I was reading it from. When you were at the legislature on World Doctors, what was it? World Doctors Day, World Family Doctor Day. I knew there was
World
a
Family
specificity.
Doctor Day.
World Family Doctor Day. I mean, there's so much stress associated with when you need your physician. You not having access is exacerbates an already horrifying often scenario. And I love what you said here, because you're actually calling for primary care reform that prioritizes treating patients themselves over treating the diseases they suffer from. Like how do we need to change the way our system is set up? Because clearly before there was even a global pandemic, it was broken. We were having long conversations about wait times in emergency rooms, wait times for surgeries that weren't even elective surgeries, but actually urgent surgeries were often, delayed due to all of the pieces of this sort of house of cards that feels so, it's so, what's the right term? It feels like one small blush of air could just bring it all down in this moment. It feels.
And that's really what it is. It's kind of a house of cards scenario, and we're already seeing the house collapsing. And the reason is because an effective primary care system in the form of a longitudinal family doctor relationship is the bedrock of any successful and efficient healthcare system. That has been shown over and over again. And when the bedrock of the healthcare system crumbles, you see it manifest in increased emergency room visits, increased hospitalizations, increased surgeries, and increased mortality, frankly. And it's the patients of British Columbia that sadly are paying the price for the fact that our province is not adequately supporting the longitudinal relationship with a caring family doctor that invests in getting to know the patient, getting to know how best to meet their healthcare needs, that can only be developed over time and through, that relationship, building trust, knowing the past history, knowing the family risk factors, and that will not be delivered in the episodic care model that the urgent primary care centers, for example, are delivering, and it will certainly not be delivered when people are forced to go to the emergency room to get their primary health care needs met. So to address all of these crises that the healthcare system is trying to navigate right now, it starts by building up and supporting the bedrock in the form of the family doctors.
We're with Jennifer Lush, a BC family doctor and consultant on how we can correct and adjust to have a more robust healthcare system when it comes to family physicians and access to GPs. I think people don't really understand. I'm lucky to have a family doctor who I've had for a long time. And I was in his office recently for the first time in a long time because most of our appointments had been virtual. And I looked at him and I said, "How are you? How are you doing?" Right? Looking to the overworked, burdened global pandemic, trying to carry it all. And he said, "You know what? I'm doing pretty well now that I've gotten the tripling of my overhead because my building was sold and all of a sudden it's 3 times more expensive." And people don't necessarily understand, doctor, that physicians do run small businesses on top of actually being physicians, right? Like I've never really understood why there weren't some breaks for physicians in order to have a practice where they don't necessarily have to run it like it could be a restaurant. It could be any small business that they have to cover all of the staffing, all of the insurance, all of the lease payments, everything, and be a physician.
Exactly, yes. And the challenge is that we are running small businesses, but unlike, say, a restaurant or a retail business, where if the cost of doing business goes up, that they can transfer that cost on to customers to offset the inflation, family doctors have not had the capability of doing that. Our fee codes have gone up. In the past 2 years, our fee code has increased 10 cents. And over the past 12 years, 10 cents in 2 years. And over the past 12 years, it's not a whole lot more than that. Whereas if you look at the cost of doing business over the past 12 years, the cost of our overhead, the cost of every piece of equipment that we have to buy and provide has gone up 29 to 30%. So it's no wonder that we are now saying, we basically are providing the government with infrastructure, and it is becoming increasingly unsustainable. So it is a totally reasonable ask that the government provide overhead support for family doctors. To keep us functioning, to retain us in the businesses that we have successfully established. We know how to do this. We know how to run the business, but it's just dollars and cents, and the cents are not adding up right now. The costs are just far outweighing our income, and so we are asking for overhead supports. We are asking for fair compensation for the expertise and the time that we are offering to our patients to allow us to keep offering the quality care that British Columbians deserve.
There's so much there, and I'm astounded that hasn't already come into play because of the need in this capacity crisis, this BC healthcare capacity crisis that is very, very real. That right off the hop, can we not help with the overhead so that our physicians can spend more of their time caring for patients than they do trying to run that business? I'd also like to reference with you, doctor, if I may, how walk-in clinics, people are like, well, you can go to the walk-in clinic. We go to the walk-in clinic because you have a rash, or if you have, maybe a sore throat, or you have something that you need that needs, like, right now, I need this one thing checked. But then you go to a family doctor and you have a laundry list. And is the pay the same for a walk-in clinic physician as it is for a GP who has their own practice?
It is. So whether or not somebody, has never met the patient before and spends 5 minutes with them to do a straightforward visit, or whether you're a family doctor dealing with 6 issues and committing 45 minutes to your patient to give them the care that they need, that's the exact same fee. And so it doesn't acknowledge the relationship. It doesn't acknowledge, the more complex things that we need to take care of. Other things like writing referrals to specialists or, advocating for our patients. Those are all longitudinal family doctor roles, and so those are definitely not being fairly compensated. The urgent primary care center is the same thing. The family doctors are that work there are getting far better compensated for episodic care rather than that really it should be the other way around, in that, if somebody is really investing and advocating for their patients and taking more time with their patients, that should be fairly compensated. And that's what we're asking for. We're asking for pay equity with all the other career paths open to us, right? It's not, again, We're not being unreasonable. We're just saying, look, with our expertise and our training, there are other options out there that are less work, frankly, but are going to compensate better. What we would like to see is equitable pay. One solution would be to update the fee system so that the fee codes are time modified so that we get paid more if we invest more time in our patients, right? So if we spend 45 minutes with you, it seems reasonable that might be of more value than a quick 5-minute prescription refill.
And there's a reminder there to those of us who are lucky enough to have a family physician and go to our family doctor. Not a time to catch up, chit chat on the needless things, but if all you need is your prescription refilled, get in there, get it, get out, so that the person that does need the 45-minute appointment can get it. I just like to put that out there. Also, I want to touch on one more thing before I let you go, Dr. Lush, because I know you're very busy. When it comes to when you take time off and you need a locum, if you need somebody to come and fill in for you, isn't it odd? I find it extremely odd that the transferable skills from one province to another, never mind all of the unbelievably highly trained immigrants who come here and cannot practice because they have to jump through so many hoops, which, by the way, have shrunk a little bit with the need. But just being able to go from one jurisdiction to another and help one another out on the doctor level. Is that sort of old school thinking? Is it time for that to go away?
Well, certainly locum access is a huge problem, and that's another factor contributing to family physician burnout. We are responsible for our patients 24 hours a day, 7 days a week, 52 weeks of the year. And we are not allowed to take time off or to go on holidays unless we arrange replacement coverage for our patients. And that's becoming increasingly harder to access for, again, a number of reasons. There's other more attractive career paths open to the young physicians that typically would be our locum coverage. Other provinces are offering more attractive compensation and working conditions. So, we train up residents in British Columbia, and they either go to another province or they go to become hospitalists, and that means our locum pool is shrinking, and so it's getting harder and harder to find that coverage so that, the family doctors can take time off. Certainly, like a nationwide licensing system for locums would, I think, help, and that it would give more mobility between provinces. But I think it still comes down to we're going to have a problem in BC until we fix the fundamentally flawed system we have in BC. Locums, even if they're licensed nationally, are not going to want to come and work here if the compensation is unfair.
Right. If it's in an affordability crisis, in a housing shortage. Yeah. Well, that's what we're dealing with.
Highest cost of living and lowest compensation for our family doctors. So it's a small wonder why we're seeing the crisis.
Indeed. Well, hopefully we move the meter just a little bit by having conversations like this, Doctor. Thank you so much for taking some time out for us today.